Kia ora koutou. Thank you for joining us this evening. My name's Billy Moody and I have the privilege of being the Director of the Bachelor of Radiation Therapy. With me, I have 4 of our lovely second year students who have very kindly volunteered, had their arms volunteered, to be here to help answer some of the questions that you might have and to talk about their experiences on the program as well. So to my left I have Cornelia, Hayley, Rachel and Aidan. The way this format's going to go today is we're going to show you a quick video, which is a video of a cancer centre tour. So you get a bit of a feel for what that's like out in the actual clinical radiation therapy environment. I'm then going to go over a PowerPoint, which will talk about how to get into the program, what we need, some of the important things you need to know about the admissions. During that time, if you've got any questions, use the Q&A function. You can type in questions. You'll be able to see those. Some of those will be answered as we go along, and then some will save to the end. We will have a bit of a roundtable chat around some of those things. So without too much further ado, we will get underway with the video.
Welcome to the Bowen Cancer Centre Radiation Therapy Department. I'm Logan, I'm the Clinical Lead Radiation Therapist at the Bowen Cancer Centre. So the first part of the radiation therapy process is coming in to have a planning CT scan. And in the CT scanner we have a wide range of immobilisation equipment which we use to position our patients in a reproducible position for their treatment each day. Our patients and feet are positioned in immobilisation equipment which we use to keep them still. So the first part of the process is making sure the patient is nice and straight, and we use lasers that come out of the ceiling and walls which you can see on the patient's body here, and we use those to straighten the patient, but also we use those for repositioning the patient each day as we have a similar set on the linear accelerator. We're always making sure that we have the correct patient on the bed, have all our strict identification procedures, a lot of patient reassurance, making sure that all of our equipment is correct and precise. The aim of radiation therapy is to have it as precise and exact as we can. So if we have a reproducible setup that we generate here when we capture our CT image, which is what we use to plan the patient's treatment, then that will translate exactly through to the treatment machine. It needs to be exact as we're delivering high doses of radiation each day, so the position that the patient is in needs to be reproducible on a daily basis so that we can hit that exact target every day. The next step in the process is the radiation treatment planning. So the doctor outlines on the CT scan where they would like to deliver the treatment, and the radiation therapist comes along, plans the radiation treatment to deliver the dose to the tumour, but minimise the dose delivered to the other surrounding normal tissue. The third step in the process is the radiation treatment delivery. Standardly, the radiation gets the patient from the waiting room and brings them through in the maze and into the radiation therapy bunker. The patient comes into the room onto the treatment couch, which is set up exactly the same way as they were for their CT scan. In the treatment bunker, we have an identical set of lasers to the CT scanner, which we use to align the patient first before proceeding with treatment. So to see the lasers, we dim our room lights down. So we raise the patient up on the couch, move the patient under the head of the machine, and we straighten the patient using the lasers like we did at the CT scan to reproduce that position. So at this point, the 2 radiation therapists would verify all of the machine parameters and all of the setup parameters for that particular patient and double check it against our setup sheets and all the information that we documented at the CT scan. And once we're happy with the setup position, we reassure the patient, inform the patient that we're leaving the room, and then we leave the room. So we have a last man out button on the wall, which is a sounding alarm, which alerts everyone in the treatment room to be out of the treatment room except the patient. We also have laser gates on the entrance to the bunker as well, and if the radiation beam is switched on and then someone accidentally walks into the treatment bunker, the beam will terminate straight away. At the treatment console, one staff member is always watching the patient on the closed circuit TV cameras. Both radiation therapists are verifying all the machine parameters against the treatment plan that was generated, and the treatment is delivered. So the treatment machine moves around the patient to deliver the treatment. So on the machine, as well as the treatment delivery head, we also have a kilovoltage X-ray unit which is mounted to the treatment machine gantry, so we can take X-ray images of the patient's internal anatomy to verify the correct location of our treatment before we deliver the treatment. Modern machines can also take a CT scan as well, which we can overlay with the CT scan that we took at the original planning simulation session to verify the internal anatomy that we're treating as well. Excellent, we'll see you back tomorrow at 10 a.m.
Yeah.
I chose a career in radiation therapy as I had a couple of grandparents when I was at high school that were having treatment, so I took them in for their treatments in my school holidays. And from there, the radiation therapist asked if I wanted to go into the treatment room and have a look and see what was going on, and I did. And it really fascinated me, the mix of patient care, technology, it's very precise. And then when I did a little bit more research into that, the applications with radiation treatment planning, physics, and the fast advancing technology is what really drew me in.
I really liked the mix of science but also medical, and the fact that you really get to make a connection with people on quite a deep level. You're seeing them every day for sometimes weeks and weeks at a time. And that's what really drew me to it, was that you could help somebody medically but also really form a bond with them.
I got into radiotherapy because it was introduced to me during my first year health sci. It ticked a lot of boxes in terms of my interests. There's quite a technical base to it, but it's also focused on improving people's lives and helping them when they're in a really stressful, challenging situation. It really appeals to me because I get to see these people on a daily basis and see them over a period of time where I get to see that we are making a difference, both clinically but also hopefully in terms of their mindset as they approach their cancer treatment as well.
I'm Billy Moody, I'm the Director of the Bachelor of Radiation Therapy at the University of Otago in Wellington. I got into radiation therapy, I was looking for a job working with people, and it's a cliche you'll hear a lot from the radiation therapy stuff, but it's truly why we're in this job. We want to work with science, but we love working with people. It's the rapport we build with our patients. Some of our patients can come for 7 weeks of treatment, and we'll see them 5 days a week over that whole 7 weeks. So we're not just treating the cancer, we get to know the person and we get to know about their lives, and we get to help them at this really critical time in their life. It does sound really scary. It's not. It's such a privilege to be involved in someone's life at that time of their life. Patients are very grateful for the care and the treatment we can give and the difference it makes to their life. I think the most common question we get asked about our job is when we say that we're radiation therapists, people will say, "Oh, so you take x-rays?" And at that point we go, no, we're the people who treat cancer with radiation. A very important part of our program and our training is that the students have large blocks of clinical on-the-job experience while they're training. So they work alongside with the RT teams here to learn how to be the best radiation therapist. The staff here and all around the country are very dedicated to our patients. They are dedicated to being the best radiation therapists they can be and delivering the highest quality of care. That extends to our students as well, and training them to become radiation therapists. The job isn't about cancer. The job is about people. And when people come in here, we're not necessarily talking about their cancer every day. Many of our patients, we come in, we have a joke. Yes, there are questions we need to ask, and we're always making sure our patients are well for their treatment and that we're going to manage any issues that they might be having. But generally, we just really enjoy hanging out with people every day.
Okay, so that was a bit of background about our clinical work that we do as a radiation therapist. I'm just going to share a PowerPoint with you now. So I'm not going to play that, just get that one. Let me. What is radiation therapy. So we talked a lot about we treat cancer. That is the main part of what we do for the job, and we're using radiation therapy to deliver that cancer treatment. And we're working very much as part of a team. And we'll talk about that a little bit more as we go on. Now, it's often we talked about that, yes, when we say we're radiation therapists, people go, oh, so you take x-rays, and everyone's nodding around the table. And that's our sister profession. We came from a single profession, but we are now two separate professions. So the diagnostic, our medical imaging colleagues are the ones who take x-rays, CTs, MRIs, nuclear medicine, ultrasound. We do use some of those technologies, but we're using it in a very different purpose. So we are the cancer treatment, and another phrase you'll hear used is oncology, which means the study of cancer. We always work in a team, and that's something, if teamwork really appeals to you, this is a good career option for you. We're part of a much bigger health profession team that is working to deliver the best care to our patients, and so on. We've got some examples of the people we're working with, so with the doctors, with medical physicists, nurses, dietitians, social workers, and this is on a daily basis that we're working with these people, as well as our own radiation therapy team that we work in. The video did go over that there are three main areas that we work in. The first one, CT simulation. So this is where we do use a CT scanner, but we're using it for our very precise purpose of determining the patient's anatomy. We're not looking to diagnose, they've already had diagnosis, they may have had other treatments already, but at our CT, we're going to get the patients lying in the position that we need to treat them in. We're quite particular about that, and we're using that CT scan just to determine the best, to determine that anatomy and the best way that's going to help us to deliver the radiation therapy. The second part is the planning. So we use sophisticated 3D software to design the best way to deliver the radiation. So what we're always wanting to do is give as much dose as we can to the cancer, to the tumour, but ideally we'd really rather have no other tissues get any treatment at all. So the plans that we're devising are working out, well, what is the best way to do that? How can I give as much dose to the tumour, but how can I minimise treating all of the other tissues? So a simple plan can take half an hour to complete. A complex plan could take several days to complete. So it ranges through that. And as radiation therapists, we are responsible for ensuring that process and that plan is completed to that best standard. Once the treatment plan has been devised, once we've worked out how we want to deliver it, we then go to the treatment machine, and this is where the treatment is actually delivered. So we use linear accelerators. These are high energy X-ray machines, so they can deliver up to 18 million volts of radiation, of X-ray radiation. The treatment itself, most appointment times are around 10 minutes, 10 to 15 minutes. Most of that time is taken with getting people set up in the correct position. Accuracy is everything for us. We have 0 milliliter accuracy is what we're aiming for. So getting the patient set up actually is what takes most of the time. Nodding and agreeing, yeah. The actual treatment delivery itself, less than a minute. So that's we're very fussy. So if you're good at attention to detail, if you're quite precise about things, that's the quality we're looking for in our radiation therapists. So what kind of things, well, during your studies you'll develop? So thinking about that, we've got the technical side, but we've also got that patient communication side. There is quite a lot that we develop. So excellent communication skills. So that's working with our patients, but also with those multidisciplinary teams that we work with. Problem solving skills, teamwork skills, the technical skills, empathy. And as I said, an eye for detail. And one of the ones that's quite big is being able to flex and to be adaptable across the day. A day can change quite rapidly. So those are things that you won't have right now at the start, but that's what we'll build for you across the degree. What's it really like? So I'm going to go over this quickly, and then these guys will talk to that a bit more at the end. So what's it really like? It's generally a Monday to Friday work week. It is a really vibrant working environment. As I said in the video, it's not, lots of people must say, oh, it must be sad. It must be sad. It's not. Obviously, there are some patients where it is quite sad, but generally, it's a great working environment. In the team, a lot of our patients are outpatients, so they're well, they're living at home, they're coming in each day for their treatment. Very few of our patients are actually within the hospital itself. One thing that's really good, I think there are lots of opportunities overseas, lots. And I will talk about that a little bit further along the way. But if travel is something you think, now that we've kind of opened ourselves up to the world again, something that you would like to do, this is a great career to travel on. One of the other questions we always get asked is it safe? So yes, it is. Obviously, we work within a lot of legislation and regulation, but when we're delivering the radiation treatment, we are not in the room, we leave the room. So the patient is on their own in the treatment room, but we're watching on cameras and we've got microphones set up the whole time. So it's quite safe for the patient, but because we've left the room, it's very safe for us. So we get no dose of radiation. You can work in, you're pregnant. You can work right the way through, 9 months of pregnancy, perfectly safe to do that. And as we say, you're likely to receive more radiation from flying than you are working as a radiation therapist. So now that we've sold you on the career, how do you become a radiation therapist? Well, the Bachelor of Radiation Therapy is based in Wellington. We are at the University of Otago, but we are at the Wellington School of Medicine. And we have clinical partners around the country that we place for do your clinical placement, which I'll go into a little bit more detail in a minute. One of the things about our program, so two things. One, we are the only program in New Zealand that trains radiation therapists. We are it. And one of the great things about our qualification is once you've done the 3-year training program, at the end you are registrable immediately. That means you can go and work within New Zealand or overseas. You're fully registered. You don't need to do anything further to gain that registration. So you're basically work ready right at the end of your 3-year degree. We have a number of admissions categories, and we'll just talk a little bit about some of them. We are a competitive entry program. So that means we have a limited number of clinical placements. At the moment, we have about 25 places per year. So there's a process that we go through in the submissions. Important dates, really important dates. The applications open on the 1st of August and they close on the 15th of September. That is a hard closing date. If you miss that date, we won't see your application. We also have some admissions subcategories looking to more Māori, Pacifica, refugee subcategories, socioeconomic and rural categories. If you think any of those categories might apply to you, we've got some information about the website. There's lots of information about the website, and I would encourage you to go and have a look on there about the details of what that actually means a bit further. So I'm just going to talk now about what the criteria is for school leavers. So we do take people straight from school. We also take people from after 1 year, 2 year, graduates and alternative categories as well. But for the school leaver category, these are the regulations that we have. So you need to be doing an English rich subject, what we call, and that is the list we have there. If you're not doing one of those, unfortunately, that is the list that we have to stick to. So at this point, that's what we require. The maths, we don't mind if it's statistics or calculus or the sort of more generic maths one. Both are useful in the course and you won't be disadvantaged by doing one over the other. The third subject that we require is physics or biology. I stress you do not have to do both, it is either. And what we need to see that you're doing, that you were enrolled in 16 credits within each of those papers. So that's our level 3 criteria. Now, obviously, when you're applying and you're closing off at the 15th of September, we don't know your level 3 NCA results. So if you are successful in being offered a place on the program, it is a conditional offer for you until we see your NCA results middle of January. So that's how that process works there. The other selection categories, again, I would recommend you go and have a look on the website. If you're at university, we're looking for, if you're at Otago, a GPA of 4, which equates to a B-. So that's the minimum criteria that we're looking at. And if you're now at university, we're not going to really look at what you did at school, we're now looking at your university study, and we're looking at those papers and those results that you've gained at university. So, how do you apply? It is through the university system that you will apply, which is called eVision. It's the student portal. If you're thinking of applying to Otago, there are lots of dates to watch out for. So the applications for this program open on the 1st of August and close on the 15th of September. There are different dates for scholarships, and there are different dates for residential colleges if you're thinking you want to go to Dunedin as well. So do have a bit of a look at what the dates are and what the cut-off dates are for things. But for the application for our program, 15th of September. So it's going to looking for the health sciences undergraduate programs and then radiation therapy from the list. Once we reach that 15th of September deadline, we're then having a look at all of the applications that come in, and we ask you to provide, so we're looking at what your academic performance has been. We get you to do a CV and we get you to do a statement of interest as well. If you meet the criteria, the sort of regulation criteria, you'll be invited to an interview, and we interview in person, but we have for 3 different places that you can do that around the country. And we'll get the students to talk about their interview experience at the end. So we've got, and these again are hard dates as well. So in Dunedin, 5th to 7th of October, Wellington, 11th to 12th October, and Auckland, 13th to 14th of October. What are we looking for an interview? It's a pretty friendly process, but we're looking to see that you can make eye contact, that you can come in and create a little bit of a rapport with us, that you can give us some examples around problem solving skills and teamwork skills. It's no trick questions. We're really looking to get to know you. One thing about our program is you're very quickly out into a clinical placement, and we'll have a look at a calendar in a minute, but generally you've been on the course for 7 weeks before you go out into a clinical. So we're just looking to make sure that you've got enough sort of skills and confidence to get started. We do strongly recommend a cancer centre tour. So I know we've done the virtual one, which is fine. If you're unable to make a real life one, that's fine. But if you are in one of the main centres or able to be there, have a look on our webpage. We've got lots of dates available for cancer centre tours. COVID has, like everything, made a little bit of a mess of that. So ones may not be available in your centre just yet. We are updating it regularly, and we will be updating that page quite regularly. The cancer centre tour is generally in an evening. You go into an actual radiation therapy department. You will see this presentation again by one of the radiation therapists, but then you get to go and have a look around what an actual department looks like. And it's really good because you get a feel for that. And I think what you'll come away with is that feel we were talking about, that it's not scary and it actually feels all right. I think you get a sense of that from the tours, don't you? Yeah. Life on our Wellington campus. So you've got 25 people in your class. So it's a bit different to the really big university experience. Those 25 people in your class are your cohort, and you'll go right the way through with them. For many of us, our best friends come out of that class, and we're very tight with our class 30 years later in my case. So it is quite special, that peer relationship you'll have within your class. And again, I'll get these guys to talk a little bit more about that at the end. Some of the fun things our students have gotten up to. I think one of the things about being a radiation therapy student is you do tend to get involved in the wider cancer community as well. So you can see lots of things. There are cupcake sales for Breast Cancer Foundation, Helping Out the Child Cancer Foundation, Cancer Society, Relay for Life. So there's an opportunity to give back to the wider cancer community as well as working within it as well. And it's fun. So tell you a little bit more about the structure of the program. So the clinical component, basically the way this program is structured, most of year one is spent here in Wellington at the campus, the university here. In the middle of the first semester, there's an opportunity for a 2-week clinical experience out in one of the cancer centres around the country. So that's where I say you've been on the course for 7 weeks and then you're out for 2 weeks having a look at that. So that's our year one. Year two, the first semester is spent entirely in a clinical placement at one of our cancer centres around the country. And these guys have just finished that clinical placement, so they'll tell us a little bit more about that in a minute. The second half of the year, semester two, is back here on the Wellington campus. Third year, other way around. Still here on the Wellington campus, but your final semester in the program is back out in the clinical placements. And that's where, at the end of that semester two in third year, you pass and become a registered radiation therapist, ready to go out and work. One thing to note, you will not go to the same cancer centre in year two and year three. You go to different ones. There's quite a variety of ways things are done. We're all doing the same thing, but there's lots of ways to do it. It's really important that you get a wide experience and real life experience. So one thing with this program is you do have to be prepared to travel. We have Cancer Centre, our clinical partners are all around the country. Wellington is the most popular clinical site because everybody's put down roots and stayed here. They'll take 3 students per year, and every year about 18 want to go there. So you do have to be prepared to maybe go somewhere where you didn't think you wanted to end up. And so we ask you for a preference of where we'd like to go. We ask you for a first preference and a second preference. Generally, we can give everyone a first or second preference, unless you're Aidan, and then we make him go somewhere that he didn't think he was going to.
I did volunteer.
Yeah, he did volunteer. But that's an example of, and so generally most of the class will get to go to one or the other of their preferences, and sometimes someone may have to go somewhere else, but we will guarantee that for the next placement you'll get somewhere that you want to be. Don't know if I've told you that. So these are our clinical partners. Auckland, the main hospital in Auckland, Hamilton, Palmerston North, Wellington. There is a public department here at Wellington Hospital as well as a small private department. Christchurch, again, a public department as well as a small private department, and then the department in Dunedin. So lots of variety. Accommodation is always a big question. One of the things about us being situated here in Wellington is we don't have the residential colleges that Dunedin have, that the Otago students in Dunedin have access to. I recommend you go and have a look at the accommodation page on our website. Many of our students have applied to Victoria and Massey and have gone into their halls of residence. You were in one and you guys were in one. I'll get you to talk about that in a minute. So obviously that's outside of the University of Otago's, it's not something we control, and you would apply for those through their portals and their university systems. What we found last year is that most students got an email saying that they would place all Victoria and Massey students first, and then they would place those students, but all of our students did get in. So that's the situation we have. As well as that, you can flat in Wellington. Aidan, you were flatting, weren't you? Or if you're lucky enough to be from Wellington, you live at home. So those are the sort of accommodation options that you've got in Wellington. After you qualify, good employment opportunities, in fact, great employment opportunities in New Zealand at the moment. Like most of the health sector, it's really short-staffed currently. And that's mostly because, again, the world's opened up again and lots of our young people have been hanging around, they're off. So there are good employment opportunities in New Zealand and in overseas. The starting salary is 60,000, just over 60,000, and that will increase by the time you would be starting. They've just gone into a pay negotiation round. So it's a pretty good starting salary. You then increase automatically for the next 7 years up to about 85,000, I think. And then beyond that, it's by merit or promotion progression. So it is a set pay. If having unlimited earning potential is something that's important to you, that's not something that this career can give you. It is quite a structured pay scale, but you will know what they are. One thing that is currently being offered in 2 departments is a new graduate program where the government are giving some funding for 6 months to departments to help support new graduates into their workplaces and things like that. That's negotiated each year and it's something outside of the university, but it's something that's quite positive for new graduates going into departments. You can specialise as well. So we talked about the different areas that we work in. So when you first qualify, and as a student you rotate through all of those areas, and when you first qualify you will rotate, you will work in all of those areas. And when we say rotate, we don't mean every day. We mean you would do anywhere from a 1-month rotation, say in CT, through to it could be up to 6 months in an area, maybe longer depending on some other areas. So you do get to specialise in that area on a day-to-day basis, but you can then also become a specialist in those areas. So the CT and planning, pre-treatment areas, into treatment, into clinical education or academic education, and then into research and development. They're all kind of growing areas within radiation therapy as well. And I'd throw another one in there as well, and that is working with the vendors, the people who supply the machines. It's becoming a growing career path for some of the radiation therapists. So there is variety in the role, and you can grow it to grow into those areas that really talk to you and that are really of interest to you. Overseas. So I said this is a great degree to travel on. It really is. I spent 3 years overseas travelling on it. And we've got graduates working all around the world, really. So these are examples of some of the countries that they're working in. But we've had students working everywhere. We've got students working in, as I say, in Scandinavia at the moment, ex-students working in Scandinavia, Canada, throughout Europe. One of the countries that we don't tend to go to is America, but that's just because of their federal state differences that they have. It's just quite difficult to get in. It's nothing to do with our qualification. One thing I will say about our qualification, and I can say this hand on heart, our qualification is world standard. We are world leaders in our qualification. We are highly sought after overseas because of the standard of our training, because we train in all 3 areas of that. That's unique to Australasia, really. And so Australasian RTs are really sought after overseas because we have great skills and we have great work ethic. So travelling really is, the door is open for you. You can study further as well. There are postgraduate opportunities. So you can do an honours degree once you've done the 3 years. It's a postgrad honours, postgrad diploma, masters, right up to PhD. So there are research and there are further study options available as well within the program. Further information. So if you're think you're still interested a bit further, I really encourage you to go and have a look on our website. There is lots of information. There's a couple of other videos on there as well. This webinar is being recorded and will go back up onto our website as well, so you can watch it back again if you need to. But there is lots of information here. We also have a Facebook page which we'll be updating with events as they're coming out. So this is where you might hear about some cancer centre tours coming up, things like that. We're going to try and post things about what's happening with our students and things like that. So we're just coming to the end of the presentation. We've just got one final little video to watch, and then we'll start to have a bit of a look at what some of the questions have been. here again. Might help if I play it.
Hands-on experience. Being involved in the community by visiting people from all walks of life.
Interpersonal communication.
Friendly classmates. Making a difference.
Interactive learning environment.
Rewarding. Always more to learn. Variety.
Interactive classes.
Patient care and technology. Personal interactions with lecturers. Clinical experience. Hands-on learning. New challenges every day.
Supportive groups.
Close to home. Lots of different people.
Caring science and technology.
A strong and fun team environment. Make a difference. You get to meet heaps of cool different people.
So that's a cohort that have been qualified. Some have just qualified and some have been qualified for 2 years now. So they were a cohort from a couple of years ago. So at this point, we'll have a look and see what questions we've got going on. I'll just have a look here. Peter might.
So we've got a question, Billy, from Nikita about, as a high school student, what's the best advice you can give someone to increase the chances of acceptance into the program?
Okay, so good question. I think one of it is, and this is what you're going to get from every program, is obviously you want to try and do as well as you can in your studies at school. As I say, we are competitive, so we are looking at what kind of grades you get. Coming to the interview, as I said, we're looking for, have you got those sort of those people skills? Can you talk to people? Does it come across that you're interested in people? And it might be a good point to talk at this point about the interview itself. Do you want to tell us about that, Cornelia? Do you remember much about it?
Not really, it was a bit of a blur. Yeah, no, it's not as scary as it seems. And yeah, definitely just getting into the questions and just coming across that you're enthusiastic and you want to do this degree.
Yeah, how did you others find it?
It was a lot less stressful than some of the job interviews I've done. There was a bit more of a friendly environment there, so if you've done job interviews, it's been quite intimidating. It's, they put you a lot more at ease, for sure.
Yeah. Anything else?
Yeah, Billy and Peter both interviewed me. I don't know if they did everybody else, but they are very easy to get along with, so they definitely make it an easy process. So going in nervous, they definitely settle the nerves, so yeah, they don't bite.
Only much you hear.
Yeah.
Yep. Great.
Right, Rebecca Gray would like to know about how big an interest you have to have in physics and how demanding the physics is on the program.
So there's a reason why we say physics or bio. So we know a lot of people don't do physics at school, don't continue it on into that year 12 and year 13. Our paper is not called physics, it's called radiation technology. And it is very applied to your career as a radiation therapist. You want to share a bit about that, Hayley? How did you find it last year?
I was actually someone that never really enjoyed physics as a subject itself, but the appliedness, like our applied physics aspect is actually really enjoyable. I quite enjoyed radiation technology last year, but didn't quite enjoy physics itself before, which was really interesting for myself.
Yeah. Had any of the others, have you done physics much before?
Yeah, I did at school. I did scholar physics, and it's easier than that. The actual physics and the math level of it is probably somewhere between level 2 and 3, in my opinion. So it's not intimidating. You don't have to know a lot of math. It's just, yeah.
And you can use a calculator.
And you can use a calculator.
Yeah. So it's really the radiation technology or the physics you need to know about radiation, about working safely with our equipment, about how the equipment works, but at quite a broad level. And we know that a lot of people haven't done physics at school, so we put a lot of support around it. The paper is structured and designed in such a way that it takes into account that lots of people will not have done physics. So do not, if you think you're interested in radiation therapy, do not let the physics put you off.
definitely say that whether you did take physics or not, I wouldn't say it made any difference moving forward.
Right, we've got a question from Kate about any problems being an Otago University student in a Vic University hall. I don't know if any of you guys stayed in a hostel?
Not really. I think it was just, I guess, going to a different campus than everyone else.
Yeah.
But other than that, it was pretty much the same.
Also, it is just a bit annoying, not annoying, but more inconvenient having to liaise with two universities. I mean, lots of people apply for two universities anyway, but going to one and then having to make an account for another university to apply for their accommodation gets a little bit confusing and niggly. So if you do that, use the same password because it gets tricky. But yeah, I think the hardest part was just that we have to be on campus essentially, and they don't. So lots of the Vic students are sitting in their bedrooms all day doing Zoom lectures, and we're up and out by 8 o'clock every morning. But I mean, you have time to socialise, so no problems.
I think this is a good point to say. So one of the things I haven't really talked about is because we're a competitive entry program, it's always really good to have plan A, B and C. You know, have multiple options on the go if you've got multiple interests and things to apply for multiple things. I'm telling you, we recommend that. That doesn't, if you come to the interview, we're going to possibly say, well, what else are you interested in? We're expecting you to tell us, and it doesn't disadvantage you from being in, you know, from the program at all. It's very sensible to do that. If you're looking at your backup plan, and so I'm talking to school leavers sort of really at this point, if you're looking at your backup plan as being going down to Dunedin to maybe do health science first year or something like that, yes, you will have to apply for two halls. You would be applying for one in Dunedin and then trying to potentially apply for one here in Wellington as well. If you get accepted into our program here in Wellington, the Dunedin halls will refund you the deposit that you've made down there. As I said, we don't have any control over the Vic and Massey halls, so it doesn't work the other way. But at least you know that should you get accepted onto this program, you're not losing the money from the hall down in Dunedin. So I think that's an important thing at that point to just point out. Yeah.
All right, we've got a question from Ashley based on for first year health science students. Are the interviews solely based on your semester 1 paper results?
So the interviews aren't based on your results at all. So our interviews are based on you as a person. When we come to look at your results, we look at the full year. So we're not making offers, so it's probably a good place to talk about timelines beyond the 15th of the September in the interviews. So if you've been offered an interview and we do that interview, if you're not successful from the interview, we will tell you sort of a week or two after those interviews have concluded. If you're still, if we're still looking at you going through that process, we don't make offers until the mid-December. So we make those at the same time that we make all of the other health science professional programs offers. So it'll be mid-December before you hear, and at that point we've got your full year's worth of results, and we look at the full year's worth of results.
We've got a few questions about numbers, Billy. How many people typically apply for the program each year and how many get accepted?
Yeah, so we generally have around 120 applying. Last year we interviewed, I think it was just over 80, and 25 students are on the course. So basically if you make it to interview, you've kind of got a 1 in 3 chance of getting it, essentially. Yeah, so that's the kind of numbers we're working with.
Yeah. We've got a question from Ria asking how you deal with the emotional stress when patients pass away or the treatment doesn't work.
Great question. Rachel?
It can be hard, of course. If you're going into the career, you're very empathetic and you are not emotional, but you've got emotions. And we're dealing with human lives. But I think most of our patients come in and coming to see us is the best part of their day, or we make their days there with us as good as possible. So if you do lose a patient, it is a matter of remembering how you made them feel and knowing that you did everything you could to help them. And unfortunately, sometimes it's not the best outcome, but you've got to remember that you were doing everything you could and that you've made a difference to them and their family as well.
Would anyone like to comment on the kind of supports that you get in the clinical?
Yeah, so we've got like obviously our clinical educator who's like someone who you can always talk to anytime, you can cry to them anytime. And they honestly like know what you're going through, but you can also talk to other staff members, you can talk to your other people on placement with you, and then we end up so much stronger as a year group after going through placement because we can talk to each other and we all know what we're going through. And yeah.
To add to that, we do have a program that is run by one of our lecturers, and we do a Zoom session once a month and we get put in groups, and basically we can reflect on our experiences at placement since the last time we spoke to each other. So there's a lot to get off your plate. We're offered EAP. We've got counsellors here at the university, so there's definitely lots of support out there.
And the RTs themselves, like we're talking about, RTs are empathetic people, and most of them are very empathetic towards their students as well, and are very useful, helpful teachers, and also provide this, a good learning environment.
Yeah, I think one thing to remember is so you really only got that very first 2 weeks, which is kind of a taster of the profession. Before you're really out there, you've done a whole year with us, and we have several papers that are working to address communication skills and very explicitly talking about coping strategies and life stages and things like that. So we're kind of not sending you out there with nothing. Yeah, and as I say, we put a lot of wraparound support around those as students. It is a great question. I think it's worthwhile noting that for our workload, about 60% is probably what we call radical, where we're trying to cure the patients. 40% is palliative, where we're not aiming to cure the patients anymore. We're looking to control symptoms, manage pain, give a better quality of life. But we know that the disease is life-limiting, that there will be death as an outcome. So it is a big part of our job, but it's a really rewarding part of the job, as Rachel said as well. It's such a privilege to be in someone's life at that time and to know you're actually making a difference to them at that time of their life. I think for most of us, we get reward from that. And yep, there is always the patient that you're really going to connect with. But they're special too. Yeah, great question.
A question from Zara. Are there areas outside of cancer treatment that radiation therapy is used for?
Well, radiation is used for a lot of things. So within radiation therapy, it's mostly cancer, and so as a radiation therapist, that is primarily what you're going to be using the radiation for. But radiation itself, as a modality, is used for an awful lot of other things, including in research, looking at cell lines, I might be irradiating the cells and things. Blood products can be irradiated. Lots of products that are on your shelf in the supermarket might have been sterilised with radiation. So there are lots of other uses of radiation. We're very specifically using it for therapeutic purposes for cancer treatment. I hope that sort of answers your question on that one. Yeah.
We've got a question, we've had a few of these actually. When you're on placement, do you have to find your own accommodation? What is recommended? By a caravan?
Yeah, you basically sort of have a bit of time to sort it out. It can seem quite immediate, and I know there was for our year group a fair bit of stress knowing exactly where we're going to end up. But I don't think anyone failed to find a place.
And if you go to Palmerston North for placement, there is accommodation available for it. They find accommodation for you, which is really good. Yeah.
Yeah.
We do also have a clinical liaison called Mel, and she said to us, if you're struggling, flick me an email. They'll send an email out to radiation therapists, see if they've got a room. So they're not going to leave you homeless.
So we've never had anyone homeless. So yes, it is up to you to find your accommodation in placements. Some students choose to flat together. So sometimes there's a little bit of a flat swap that goes on from year to year, but that can be a little bit variable. But like, as I said, we've never had anyone on the streets.
And because it's a 6-month placement, at least that the second and third year ones, that's a decent enough chunk of time that it is worth like moving for. You don't have to find like a 4-week lease or anything like that.
Yeah.
A few questions about first year health science or entering after 1 year of university study. Does it matter what subjects people have been studying? How many papers do you need to qualify as being first year? Those sorts of issues.
Okay, but generally we're looking, so if you're coming from health science first year, you've done a prescribed set of papers anyway. So those are the papers we're looking at, no problem there. If you're coming from a different degree, basically our wording is that it's a relevant degree. And really we're looking that you've done more papers that are in the science, psychology, physiology, that kind of area. You know, the things that we're going to cover within our papers, those are the sort of, so if you're coming from a BCom, probably not so much. It's not going to be that useful to you. But if you've come from those science kind of areas, generally one year of university we're saying is a full-time equivalent. So depending on what university you're at, that has a bit of a variation on how many actual numbers of papers, but we're looking at what would be considered a full-time equivalent study load, essentially. What I would say, if you've got a specific concern about what you've studied and whether it meets the criteria or not, flick us an email. On our webpage, you'll find there's a generic contact for, it's labelled RT inquiries, and if you send an email to that, we can talk to you a bit more about your specific circumstance and whether it will meet. Who came from school and who came
Cornelia
from?
and I did.
Yeah.
I came from a year of uni.
Okay. Yeah.
I did a different degree first and some work.
Yeah. So your year at uni?
I studied psychology as a Bachelor of Arts at Waikato Uni. I had applied for radiation therapy, was interviewed and didn't get in. But yeah, I went into psychology. I did actually call Billy, probably won't remember, but I rang Billy and I was like, do I work full-time for a year or study for a year? And she said, study for a year, do psychology, do biology, something like that. And that's what I did, and now I'm here. So yeah.
And I think that's a great example too. If you apply and don't get in the first time, apply again.
Yeah.
And we've had people who've applied 3 times before they get in.
There's no shame.
And we actually welcome reapplications. We're really keen. Someone who's applying again and is really showing you're really keen. So it's not a barrier.
I think I applied the second time after 5 years. I applied out of high school in 2015, 2014.
Okay. Yeah. So good examples of, don't let it put you off if you don't get in.
Yeah.
If you go and still do a year and still think, no, this is what I want to do, come back to us.
A question about how you deal with patients who may be harder to connect with or potentially cause some problems.
That's a good question.
Yeah.
I guess there's such a diverse group of people in a radiation therapy department that actually you might just not be their kettle of fish, and someone else might be able to connect with them a lot better. But because we work so much on those communication and those rapport skills, we are able to you find little loopholes and avenues to connect with them with, and sometimes you might not find that, and that's absolutely okay. Some people just prefer different ways than others.
Yeah, building on that, at least in my experience, some patients just want to come in and out saying as little as possible and just get over with. Might not even be the thing they're most worried about that day. Whereas some other patients love coming in, having a chat, debriefing to you about their day, and you communicate, you're trying to communicate as well as you can with every patient, but some are just there to get their treatment and leave.
Yeah.
So
and maybe they get support elsewhere.
Yeah.
I think 9 out of 10 patients are so stoked to be able to see you every day and are more than happy to sit down and have a chat with you. So few that you don't per se connect with so minor in a day.
You're also very rarely alone. I won't say never in a room alone with a patient, but there is usually another RT with you, so they'll always jump in if things are looking a little bit interesting. So yeah, it's fun.
A question about what the workload is like. So Billy and I will pretend not to listen to your answers.
It's honestly not too bad. Going into it, someone told me that it was like 8 to 4 every single day for first year, but it's actually not. And I think the first years have Mondays off this year, which is quite good.
Generous.
Can't guarantee it for next year. But no, it's not. It's definitely doable. It's definitely bearable, and
It's probably comparable with most of the professional health science courses. The workload on placement is pretty much a 40-hour week. So you show up for work every day. It's just like work, really.
You do still get time for a social life if that's an issue. We've all got friends outside of uni. It's not like we just huddle together on a weekend and study. But yeah, you do get time to do your own thing and relax.
We really want you to have a social life. So we don't want you, and the course should not require you to spend every minute just studying. I think one of the things that once you're the competition is to get onto the course. Once you're on the course, you're on the course. And we're wanting you to always do your best, but there's room for that.
A question from Ria, what's something you wish you had known before starting to study radiation therapy?
Ooh, I have to think about that one.
That is a good question. I don't think I felt like there was. I think the first year prepares you so well. And first year is mostly classes from that short placement. I think it prepares you pretty well to have a good idea of what you're walking into. In second year, and then second year you wish you knew everything, because everything's so overwhelming at that point. Step into a fully functioning department, but I don't think you need to know anything special for the first year, other than the requirements of entry.
I think one thing I very clearly remember, and this is a really long time ago, but I still do remember, I think for me it was, I guess I wasn't quite prepared for how up close and personal we get with our patients. So we are in their personal space. There is no personal space because we are we talked about that positioning and getting ready. So we're like here and they're undressed. We've got to get to the area so they're not wearing any clothes in that area that we're treating. So I think for me that was one thing that took me. That was a surprise, and maybe I wish I had a little bit more of a header. It didn't change anything for me, but I do remember walking in and going, what have we got here? So I think that was one thing.
And also, I guess a lot of our patients are old people, which is not really, I guess, not advertised. But I thought that'd be something that's really hard to deal with. But actually, it's really easy. Old people are so fun to get along with and stuff. And they're honestly lovely. So
we are here.
Alice is asking, in the interview process, would current employment and work experience combined with qualifications be recognised?
Sorry, what was that question?
Would current employment and work experience be recognised along with qualifications in the interview process? Yeah,
so we do have, again, this is, I think, is a good one to come to the department and ask specifically about. So if you've got previous qualifications that maybe are a few years old and you've gone out and done something within the workforce, worked for a little bit, we do have an alternative category that kind of captures that area. But again, there are some sort of, we look at that quite individually for each person because that is quite starting to get quite different for each person. So I would recommend getting in touch with us to talk through your particular situation.
A question about how you'd compare the exam system against first year health sci papers.
I can tell you that, it's very different. Okay, so our assessment philosophy is very much that the assessment will match the paper that you're working on. And that's not to say that's not the case in the health science first year, don't get me wrong. But we have quite a range of assessments, and not every paper has an exam. So at the end of semester one, the year ones had one exam. At the end of semester two, there will be 3 exams. In year 2, there's only 2 exams, and in year 3, there's only 1 exam. Lots of them are internally assessed, and there are lots of different assessment types that will match the paper. So, for example, when we're teaching the planning paper, we will get you to create a plan, and then we'll get you to come and talk to us about that. So it very much fits with what the philosophy of the paper is.
A question about how challenging the first year is, assuming that you're going after finishing college, even though the class size is similar.
Question. First year is, I'm not going to lie, it is challenging. They bombard you with information. You spend a whole year learning about everything to do with the body. The lecturers, they push you, they do, and they fill your brains with information. And at the end of the year, you sit there and think, wow, that was pointless. And then you get to placement in second year and it all comes together. Yeah. It's ridiculous how the pieces just fit together. But it's not easy. But is any university degree easy?
Having, I'd say from my experience, it's probably on par with the Bachelor of Science I did. Maybe, one of the paper that's definitely harder is the anatomy paper, and that's a full year paper, and that I'd say is quite challenging. But overall, probably on par with, or maybe a little bit harder than a Bachelor of Science, assuming you're taking the Bachelor of Science seriously.
I think one thing with particularly the anatomy paper is it's the volume of work as well. Yeah. So it's one that you do want to keep on top of, but it's a very well structured paper. So if you follow the lectures and you follow the structure of the paper, it's been designed to help you get through. So I think it's volume of work for some papers, maybe brand new concepts in other papers. So I teach the first year planning paper, and that hurts brains a bit because it's a lot of very new, nothing you've done before prepares you for that. So it really depends on, and you're going to find your area of strength as well, which will differ from person to person. Yeah.
I'd just like to add as well that the lecturers are very supportive. Like they want us to pass. They're not here to make us fail, so they will sit down with you until you understand, essentially. So you've got a lot of help, and because it's so niche, it can be a bit tricky because no one else in the country knows about it, other than those 25 other students. But yeah, help each other, and the lecturers are amazing at keeping you on top of your work.
We've got a question. If you're unsure about this course, what subjects from college would best match it to help narrow down interests?
So looking to select papers for a year 13, is that kind of the thing you're talking about? I think broad, the science, the maths and English writ. I mean, I am the parent of a year 13 student, and I've also got an older boy who's down in Dunedin as well. I think if you're a little uncertain, stay a bit broad with what you're doing to give yourself options. And that won't shut this one off to you, but it will open up health science first year in Dunedin or engineering in Christchurch or whatever it might be that you're interested in. So that would be my advice.
There's one specific internal in physics that I did which made me want to kind of do this degree, and it's like nuclear physics or something, and it's pretty similar to kind of the physics that we end up learning. And yeah, that's pretty similar to...
Not many schools offer it. Pretty rare it's offered.
And we've got a question about after getting your degree, how would you go about seeking jobs overseas?
You guys don't know. Really, well, it's not difficult. So you can apply directly to a department if there's a specific department. There are some really big centres overseas that some people will want to work in. in Australia, there's an enormous one in Melbourne called the Peter Mac. In the UK, there's a Christie. So there are really well-known hospitals that you might join to. You just apply directly. A lot of people, when they go overseas in the first instance, particularly to the UK, where there is a lot of locum work, and there are agencies that will find that locum work for you, and can find permanent work for you as well. So it kind of depends where you're going. A lot of countries will have that locum agency work, or you can apply directly to a centre if there's somewhere doing something that you think you're really interested in and want to go and work there.
I think we've answered all our questions.
Right, yeah, and I'm just a little aware of the time as well. Right, so that was an opportunity for the questions. They were great questions, and I really want to thank you guys for being honest and sharing your experiences as well. If you go away from this and think about that great question, email it to us. Please get in touch with us. At RT Inquiries email on our website will come directly through to our department. So any specific questions you have about your situation or anything that you sort of forgot to ask or think about later, don't be afraid. Please do ask us. So I would like to take this opportunity. I really do appreciate your time. It's an hour out of your day that you've spent listening to us, and we really do appreciate it. I hope it was useful information for you. If you can, try and get to the Cancer Centre tours, have a look for dates on the website, try and get to those. We will be at the Otago Tertiary Open Day on the 1st of August. We will have a stand there. So come and talk to the people on the stand. There'll be more students there. Some RTs who are working in the clinical will be there as well, so that's a great opportunity. Otherwise just get in touch with us and follow us. So I really do hope that has whetted your appetite and you're now really keen to become radiation therapists. We will now have your email address. We're not going to spam you, we're not going to bombard you with stuff, but we will remind you about dates coming up and things like that, so we will just stay gently in touch with you. Otherwise, I thank you very much for your time and have a lovely evening, and I hope to meet some of you at interviews soon, not too far in the future. Thank you very much, everyone.